rare cancer. And people at the CDC were looking at it and saying, something's got to be up.
I mean, not rare, I mean, more prevalent diseases that might occur. Accurate ones in particular.
Well, nice. The bacteria living in your bronchioles can multiply, and your immune system can't really keep them in check as well as it used to. So there is.
So do you mean more like pneumonia?
Yeah, that's right.
Is it, do you know if it's HIV itself that causes, that generally causes death, or is it?
No, HIV itself does not cause death. HIV causes death of certain white blood cells, namely the CD4 pluses and T4s, which are your primary combatants of infection. They work. They are your immune system basically, and without these cells, you can't really fight off infection. So it isn't AIDS or HIV that causes death. It is rather an infection resulting from HIV.
For HIV treatment, you're going over, you mentioned combination therapy. Did you guys go over anything that they use nowadays? Any combination therapies? Like 3 of them together, or maybe 4 of them?
Well, I didn't delve into it, but basically, I read over, they combine the NRITs and the NNRITs, and they just like use different combinations of those to use. Like, I'll look at it.
You were talking about doxycycline used as treatment for gonorrhea. What's the monitoring you need to talk about with doxycycline patient? What's the most important thing, other than the curing of gonorrhea, that you should tell the patient to watch out for, especially if it's like they live in the south or something? Sunburn. Like you're really predisposed to get really bad sunburns. You have to probably avoid being outside.
And alcohol. Oh, that's true.
Also, whenever you take medication, you shouldn't take it with antacids, generally, because it'll cause accumulation effect, so it's just going to bind to the antibiotic and it's not going to work. So antacids, dairy products, minimal. So you're going to want to make sure you tell them to taste the medication part.
Reciprocal fly system. Tell me about how you use that in terms of treatment for gonorrhea. Like, how would you counsel the patient using that message?
One gram.
Pretty much the same thing that they said earlier, because you guys need to not be doing that.
triaxone dose. I believe that I think that's more of like for a weight-based dosing, so maybe for somebody who's very lightweight, very skinny. But I think generally it's about a gram. Yeah. And then I think the step route, it also depends on the extent of the infection.
Yeah.
You might have to.
It's from like 250 to 100.
Yeah, and you might have to treat for a couple days though, depending on how severe your infection is. Do you guys know why you don't give the just like the toxic pregnant women? Yeah, because it's actually category X, and it's gonna have that expense on the baby.
So several fluxes.
Yeah.
You can't use them for little kids because seriously
Yeah, it's permanent yellowing of the teeth.
permanent stigma.
Are there questions, wisdom?